You're absolutely right. Next will be Senator Cardin.
Thank you, Mr. Chairman. Secretary Becerra, welcome. It's good to see you. I want to underscore the point of Senator Grassley in regards to the organ transplant issues. The reform of the OPTN process will save lives. We lose 17 Americans every day awaiting an organ transplant. So this is an urgent issue, and I just thank you for your response and the actions that you are taking. I want to turn to an issue of drug shortages. The wealthiest nation in the world that spends the most of any nation on drugs, and yet we have important drugs that are in shortage supply here. According to the American Society of Health Systems pharmacists, 160 drugs were added in 2022 to the drug shortage list. 48% were in sterile injections, making a total of 295 active drug shortages here in the United States. And these are drugs that are critically important to your health care. Some are in cancer treatments and other areas. So the President's budget deals with extending the expiration dates, which I think is important. Senator Collins and I have introduced legislation on that to deal with disclosure. How do you intend to mitigate this challenge that we have in this country?
You know, Senator, I'm glad you raised this, because whether it was the issue of infant formula or whether it was the winter flu, we are seeing that in so many cases, the industries that we count on to provide us effective medications aren't ready for disruptions, for a broadside. That's because we've gotten into a system where these industries, to save money, and they're entitled to try to save money, have gone towards a supply chain methodology that essentially says we're going to keep in inventory only the stock that we need immediately. And if all of a sudden you have a major increase in demand, you can't meet it. Or if something happens with a manufacturer who has to go down because there is an issue of safety or cleanliness, then all of a sudden the supply goes down and they're not ready to meet the need. And so what we have done is we've begun to do more surveillance over how these private sector industries are handling their supply. We don't regulate that supply, but we want to have more eyes on it so we can make sure they're preparing for that broadside that might come. We're also trying to make sure we help them mitigate any supply chain interruption. So if they get some of their material for their product from overseas, some country, we want to make sure there's not going to be a disruption, whether politically based or supply based, that keeps them from being able to produce. So we'll work with you because this is a big issue.
Well, as we saw for the pharmaceutical industry, how they manipulated a market for profits for insulin, the same thing's happening on less expensive drugs, where they're changing their production capacities in order to maximize their profits, which we understand. But since we are the largest payer for these services, it seems to me we can have a stronger impact on their decision making.
We'll look forward to working with you on that.
As you know, oral health is closely tied to physical health. The final calendar 23 fiscal fee schedule rule expanded dental services tied to medically necessary conditions, which means that these services will now be covered under Medicare beneficiaries. That's a step in the right direction. But as you and I know, we have major gaps in both the Medicaid and Medicare programs in regards to coverage for oral health and dental services, particularly in the underserved communities. They are particularly vulnerable. So what steps do you intend to take in order to deal with the access to oral health care in America, particularly in underserved communities?
Well, as you said, one of the first steps we took is to try to make sure that where we had the authority, we expanded access to dental care services to folks on Medicaid. And we have made the effort, and with your support, to try to expand coverage within Medicaid for dental health services more directly. We count in many respects on our community health centers, who are able to use some of the funding they get to expand services, including in dental health. And we're going to try to do everything we can within the authorities we have to expand access, because we know an infection that's related to your dental situation could ultimately impact your overall health. You know the story of Diamante Driver, a young man from your state of Maryland who died because at the end a toothache which parents did not have the money to have them go see a dentist, became an abscess, and it became an infection, and before you know it, Diamante was dead.
It's one of the best investments we can make in oral health to get great returns. Let me just say in concluding that in hepatitis C, thank you for your efforts there. We need to identify those that have hepatitis C. The treatments are there. It saves lives and it saves costs. So I appreciate the initiative in your budget, and I would hope Congress would work on budget rules which would encourage that type of services to deal with diseases.
We're backing up your hope.